welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are the latest reports from the world of medicine. Severe hypoglycemia related to heart failure risk in type 2 diabetes patients. According to a recent research that has been published in the Journal of Clinical Endocrinology and Metabolism, severe hypoglycemia is associated with a greater risk of heart failure in a large cohort of adults, specifically with type 2 diabetes. The results showed that severe hypoglycemia requiring medical assistance had a 68% relative risk of incidence heart failure as compared with individuals who never experienced any episode of hypoglycemia. Calcium-fortified beverages have beneficial effect on insulin sensitivity among the elderly population. Calcium, one of the most important nutrients, determines the quality of life of an elderly. It has been reported that 7 out of 10 people over the age of 60 have insufficient calcium intake. A recent study finding suggests that intake of a calcium-fortified beverage has a beneficial effect on insulin sensitivity and some antioxidant enzymes in healthy elderly. It has shown that such beverages, that is the calcium-fortified beverages, are promising agents for the management of diabetes as well as antioxidant metabolism. Nicotinamide and pyruvate help improve vision in glaucoma patients. Nicotinamide adenine dinucleotide, which is NAD, is a redox cofactor and metabolite that is essential for a neuronal survival. While glaucoma is a common neurodegenerative disease in which neuronal levels of NAD decline, a new study reveals that a combination of nicotinamide and pyruvate significantly improved the visual function in the short term. The development of novel neuroprotective medicines for glaucoma patients may be enabled by the selection of drugs that are targeting on the NAD and bioenergetic capability to boost the cellular resistance. Consecutive back-to-back quadruple therapies significantly improve patients with H. pylori. H. pylori, which is the Helicobacter pylori, is present in around 40% of the world's population. H. pylori eradication elevates the gastric atrophy and avoids metachronous gastric cancer as a prevalent infection causing a variety of gastrointestinal disorders. As per a recent study, consecutive therapy with amoxicillin, tetracycline and even furazolidone yielded a higher eradication rate with acceptable compliance and tolerability in difficult to treat H. pylori infection cases. Hence, even after a previous H. pylori eradication failures in a specific population, consecutive therapy can be capable of achieving a good eradication rate more than 90% regardless of a medication history of these 3 antibiotics. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.